Okay, we're here today with Dr. Wigoda, and it's Breast Reconstructive Awareness Day. So, Dr. Wigoda, tell us what are some of the messages that you can give women on this day to help educate them?
Well, as we all know, breast cancer is actually not not that uncommon. It's important that women are aware of their breasts and the possibility that they could have breast cancer. Certainly, if there's any family history of breast cancer, that's something that's important to know about. And nowadays, women are supposed to get mammograms usually when they're about 35 to 40 years old, and then every year to 2 years after that. And it's important that they get mammograms and they do self breast exams just to check. Obviously, the earlier you catch the breast cancer, the better off you'll be. If unfortunately you do have breast cancer, it's also important to know that there's multiple options for treatment. Obviously, there's chemotherapy, there's radiation therapy, there's surgery, all those things that need to be discussed with the breast surgeon and with the oncologist. But plastic surgeons also play a major role in breast cancer treatment, and that's with breast reconstruction. And there's many options out there, different types of surgeries. There has been a lot of advances in the procedures over the last 10 years. So I think the important thing is for women to know that they should speak to a plastic surgeon who specializes in breast reconstruction before they have their surgery, at least to know what their options are. You don't have to have a breast reconstruction if you don't want to, but perhaps if you do want to, you want to know what your options are. And so it's better to know ahead of time, because you can have your reconstruction done at the same time as you have the mastectomy in many cases. So always good to prepare ahead of time.
Are there any questions that they should ask the surgeon that does specialize in the reconstructive?
Well, they should see if the surgeon gives them multiple different options for their surgery. You can have reconstruction with your own breast tissue, you can have reconstruction with implants, and you can have reconstruction with a combination. When you use your own tissue, there's also different techniques. So you kind of want to have an idea if the breast surgeon does all the different techniques. If he only does one technique, that might not be the best procedure for you. And so you might want to see a surgeon who really can offer more of a variety of procedures, depending on everyone's particular case.
Okay, great. Okay, thanks for your time, Dr. Wigoda.
Sure.